Welcome to the Smart Business Revolution.
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 You want a revolution?
You say you want a revolution?
Revolution. The revolution.
It's going on right now.
Welcome to The Revolution, the Smart Business Revolution podcast, where we ask today's most successful entrepreneurs to share the tools and strategies they use to build relationships and connections to grow their revenue. Now, your host for The Revolution, John Corcoran.
Hey everyone, John Corcoran here. Could there be a new fountain of youth? Well, in this episode, I share an interview which raises a real question about whether there could be. This is an interview I conducted with one of our clients on his podcast, but I wanted to share it here as well because I think the topic was really eye-opening. The client I'm interviewing is Dr. David Haase, and he's a pioneer in systems medicine, which integrates science, philosophy, data, and other areas to reveal new possibilities for creating health, optimizing human performance, and even reversing dementia. So in this episode, we talk about a new development in the world of biohacking. It's a bit technical, I'll warn you, but hopefully you will follow along because we discuss some exciting new medical research which could have some big implications. Enjoy.
Hello, Dr. David Haase here, host of the Superhumanizing podcast, where we explore how new developments in systems medicine enable us to work with our bodies, not against them, to treat complex chronic disease and really create health from the ground up. Hey, I have John Corcoran here, who's done thousands of interviews with some of the top health and longevity experts. We've flipped the script today, and he's going to be interviewing me, talk about some recent developments.
All right. Thanks so much for taking the time to talk with me, Dr. Haase. This is going to be really interesting. First, let me tell everyone, those who don't know about you, Dr. Haase is a renowned medical educator trained at Vanderbilt and Mayo Clinic, whose expertise touches a wide range of specialties. He's also the author of the best-selling book, Curiosity Heals the Human, and presenter of a TED Talk in which he describes how treating dementia starts by changing our paradigms about health and disease. And now in this episode, we're going to be talking about new developments in the world of biohacking and longevity research. And, Dr. Haase, we were talking beforehand about a new medical journal article, which came out recently as a result of some really groundbreaking research that was done at UC Berkeley. And why don't you share a little bit about what that article was about and why it was so groundbreaking?
Yeah, absolutely. It's nerds like me get really excited with things like journal articles, right? I mean, other people may say, wow, what a great car that was, or, man, what a great meal. I mean, I get all excited about having somebody find a new piece of information to kind of understand reality. Because that's really what science is. Science is the exploration of reality and always trying to find out where we were wrong before. Mm-hmm. Scientists are just about changing your mind again and again. And we have to keep changing our mind. Thank goodness, because we don't want life to be just the way we are right now. We want progress. So yeah, this article came out of the journal Aging. And it's a very mainline, well-renowned journal. Milod Melapur was the primary author, and included in the journal were some very important researchers, Michael and Irina Convoy, and I'll tell you why they're important later. But in this article, they did some amazing experiments on mice to prove that by just removing old plasma out of old mice and replacing it with albumin, which is the major protein that comes from mice, is in the blood. If you just did kind of what we'd call a blood washing, or more specifically a therapeutic plasma exchange, and you just got rid of the old plasma, what happened is multiple different tissues started to rejuvenate. They started to act young and have a youthification that began. It's really a confirmatory result of a lot of prior research that has come up till this point. And for those of us who are very interested in creating health, this gives us an opportunity to look completely different at a problem and to have a higher level of certainty that by removing old plasma, we can actually help reset the body's healing set point and make a big difference, I believe, in health and longevity long term. So it has a huge number of applications.
Wow. So I know this is probably a ways off, but is this a possibility? You think this blood washing, as you describe it, the removing of old plasma, replacement with a saline albumin? I'm not a doctor, but is that something that could happen in humans? That they could recreate this therapy in humans?
Absolutely. We've been doing it for many decades already. This is essentially the application of a current medical therapy called therapeutic plasma exchange. And I'm a certified apheresis specialist, so I do this plasma exchange, have overseen this in many patients, but the indications for this particular procedure in the past have been people with very severe autoimmune disease like multiple sclerosis or neuromyelitis optica or Guillain-Barré syndrome. And these individuals have their blood pulled out via one tube and separated. The old plasma, or I should say the diseased plasma in that case, is discarded. And then a fresh replacement fluid is put back into the body, mixed with their own cells. And by diluting out the disease causing factors in the plasma, many of these autoimmune conditions can be halted, or individuals can have remarkable symptom relief from that. So this therapeutic plasma exchange is already a current, well-known, well-understood, well-studied medical procedure, and we have this opportunity to look at it differently. So the problem is there's very few doctors out there that do this type of work, and certainly not yet for patients with Alzheimer's disease or frailty, or those people who are interested in the biohacking world.
Okay, so got lots of questions here. So first of all, for those who aren't familiar with the process, what is it like for the patient? Do they sit there? Does it take all day? Is it a couple of hours? It's a tube that's in their arm or something like that? What's the process like?
Yeah, there's a lot of variation to the answer to that question. It depends a lot on what the systems are of the clinic that you are receiving the service from. So it can range from everywhere from having a surgical large catheter put into a very large blood vessel and then tunneled underneath the skin to just a peripheral IV being put in, a large IV nonetheless. And that depends upon the hardware and the software and a lot of other factors. But let me describe what we've been pioneering at our clinic to really be overthinking how do you have an increase in the safety of this particular procedure. The process is you have a large IV put in each arm. Blood comes out of one side and gets immediately mixed with an anticoagulant so that blood doesn't start to clot. And then that blood goes into a centrifuge that's running continuously. In that centrifuge, the lighter plasma is separated from the heavier cells. And then that plasma comes off into one tube and is discarded. The cells go off in another tube. And then they get mixed with a replacement fluid because, right, it's just this thick group of cells with almost no fluid in it. It needs to be diluted before it goes back into the body. And there's many different substances one can use for dilution. The most common is albumin. And albumin is a protein that is in every human, really every mammal. And that albumin holds on to the water that is inside the blood. And that's a major constituent of plasma. So the replacement fluid can be albumin, or it can be antibodies like immunoglobulins. It can even be saline, just salt water, but you can only give a little bit of salt water and then you start having a whole bunch of other problems. Or it can be plasma itself. So you can have donated plasma from another person as the replacement fluid. But regardless, you take the cells, then get combined with the replacement fluid to bring the volume of that new combined blood up to the same amount of volume that got pulled out, and it goes down another IV and goes in the other arm. So the blood is coming out, being processed, and goes right back in again.
And how long does that process take? How long does it have to be hooked up, sitting there?
That can take anywhere from an hour and a half to sometimes 3.5, 4 hours, depending upon how large that person is, how good of blood flow we get through the veins, and that you're sitting in a chair and comfortably
Watching Netflix or something.
Yeah. We have great staff. We got amazing nurses that run this procedure and are doting over you the entire time. It's a very personal experience, and but there are some side effects that can go on, but we do everything possible to minimize those, of course. And side effects could be like your calcium levels getting slightly low that causes tingling around the mouth, or nausea, or muscle cramping. And we have things that we can add into IVs or slow the procedure down to deal with those. Or there's a lot of nuance to this. This is not something that you can go do a weekend conference and learn how to do it. It's a substantially involved procedure. So
I want to ask a bunch of questions about it. So including how frequently someone has to do it. I'm sure it varies by, what different condition they're dealing with or disease.
Yes.
That's one. But I do want to ask, why is it that there aren't more clinics that do this procedure? You said it's not very common.
Well, there's many reasons. So first of all, answering your question, how frequently would a person need this to be done? There was a large study that was done looking at utilizing this procedure to actually reverse Alzheimer's disease. That is called the AMBAR trial, and it was where they looked at over 450 patients with Alzheimer's disease, and they separated them into placebo group, which just got a kind of a fake plasma exchange, and then individuals that had various types of replacement fluids put in. And in those individuals, they got 18 of these kinds of exchanges over 14 months. So it was initially once a week for 6 weeks, and then once a month thereafter. And so that was one protocol. In that group of individuals, in people with moderate Alzheimer's disease, had a slowing of their progression of 60% compared to placebo over those 14 months. Wow. 60%.
Wow.
Yeah, wow is right. It is absolutely earth-shattering.
So why doesn't every Alzheimer patient do that? That is a natural question, Yeah,
exactly. So there's lots of, and here's a little more data about that, is that the individuals with mild Alzheimer's disease, in comparison to placebo, actually had some improvement in their memory and improvement in their attention over those 14 months. So they were actually better than what they started.
Better off.
So when you started so the observation is made, it's like, it looks like if this is applied earlier, there's more benefit that can occur. And so we'll come back to why more clinics aren't doing this. Well, number one, it's very complex. It's there's expensive machinery, lots of procedures, highly trained staff, and this is not yet an established intervention for Alzheimer's disease. The process of science is a patient process. We need to prove something and then prove it again. But there's another side of this, that a lot of the things that are utilized in this process are generic materials. So there's nobody really promoting this process because there's nobody making a lot of money on it. Now, that's a little cynical viewpoint of that.
You could call it cynical. You could also say realistic. Yeah, that's an interesting good point. Yeah.
And interestingly enough, this study, even though it's been reported extensively to the shareholders of the company who did it, and it's been presented at 3 large international meetings, has not been published yet. So it's not,
okay.
We're going to see this, and we're not sure when it's going to actually be published and released. And then you're going to see a flurry of information around it.
Got it.
So, you're actually getting the scoop right now.
So this is a very bleeding edge. So how long have you been involved in doing this therapy? How long?
Bleeding edge. Yeah. Bleeding edge. That was a good pun. That was a really good pun.
It went totally over my head, actually.
Good,
yes.
Good. Yeah.
So
go
ahead.
And but let's talk a little bit about how, the training process of learning to do this. One of the reasons there's not more specialists that do this is that it's kind of a procedure that doesn't have a specialty. So individuals from ER doctors to internists to nephrologists to hematologists to pathologists to family doctors too. There's a broad array of individuals who train to do this basically out of a particular passion around a set of patients. Neurologists, quite a few neurologists as well, because many of the indications for this are autoimmune neurologic disease. And so it's really fascinating to step back and to say, wow, here we have a procedure that just kind of doesn't have a specialty to advocate for it. Now, I am a member of the American Society for Apheresis Medicine, and that is really the specialty, apheresis medicine. And that apheresis just means pulling blood out, doing something with it, and putting something back in. And that can be pulling out white cells, red cells, platelets, and there's cancer therapies that are in this particular specialty. But it's just interesting to think about kind of the social aspects of why something's promoted or why it's not promoted.
Right.
But let's get back to talking about the science part of it, because if that's okay, because
sure.
I think this is just, it was just absolutely amazing, this article. So why we started to think about this was 2 reasons. One is that many apheresis doctors in the past had witnessed that people just got better when they had apheresis, maybe from conditions that weren't exactly what were being treated. They just seemed to get healthier overall, especially individuals that had a lot of, let's call frailty, started to become just stronger and more robust. And that was just an observation, no studies around that. But then 2 of the co-authors of this study, Michael and Irina Conboy, Irina is the principal author and Michael as her husband and partner in research, did a remarkable study, and they replicated a study that had been done many times before in previous decades, but they measured a few unique things. And that was a study of parabiosis. This is where you take mice that are clones of each other. And you take a mouse that's old and a mouse that has the same genetics, but a little younger. And then you bring them together and you sew them together side by side. So they share a little bit of circulation. So some of the plasma from the old mouse is getting into the young mouse, and some of the plasma from the young mouse is getting into the old mouse. But they're running around the cage attached by this skin. And
science isn't always
not pretty, not
pretty,
pretty, not pretty, right?
Yeah.
And they are very careful to only do this to as few as necessary. But amazing thing happened in the process. So that old mouse, as it was attached to the young mouse, started to turn young.
Wow.
The liver regenerated, kidney regenerated, muscles got stronger, hair started growing back in, and cardiac output improved, so exercise capacity improved, and new neurogenesis happened. That means the mouse started to smell smells that hadn't smelled before, and on autopsy, they were actually able to see new sprouting of neurons. Now, all that happened with just being attached to a young mouse. But
Hmm.
an amazing other thing, the other part of it was that young mouse was stunted by exposure to old. So
Oh,
just old, they
mm-hmm.
found was toxic.
Mm.
So
Hmm.
the question remained then, after the experiment was done, was it that young things were taken from that young mouse and put into an old mouse, and that's what had the effect? Or was it that the young mouse diluted and removed factors from the old mouse that were suppressive, that were maintaining an advanced set of at an advanced age? So the idea that our stem cells, which are the cells that do all the repair in the body, those stem cells have this opportunity to continue healing lifelong. But when those stem cells are in an environment, say a plasma that is old, those stem cells act old. They don't do the repair and regeneration that they would if they were young. But if you just switch the environment, you change the environment, you put in young plasma, or in this study, just albumin and saline, guess what? Those old stem cells wake up and they start acting younger again.
Mm.
That is what this new study demonstrated very clearly, that just a single plasma exchange done on an old mouse, pulling out a portion of the old plasma and putting in just albumin and saline, no components from a young mouse at all, started the process of neuroregeneration. It caused the liver to turn around and become non-fibrotic, essentially liver de-aging, and muscles to increase their capacity for becoming larger and stronger. So that would all happen with just one exchange, and it made a measurable difference in that old mouse.
Wow.
So we're at a young point yet, no pun intended again, but we're at a young point of understanding just how frequently this is beneficial and for whom it is beneficial and how it is beneficial. You may know the rest of my practice is dealing with systems medicine and using some advanced laboratory testing to understand just how old people are. We use these broad scale methylation panels that do genetic aging evaluations, and we're tracking people through that. We're tracking people through the types of proteins that they make. We're measuring end organ function to see, does the heart, the heart and blood vessels and skin and hair improve? And we're very determined to figure out what works best for whom. But we're still at an early stage right now. We know that some is beneficial, and exactly which protocol is going to be most beneficial, we're just going to continue studying that in a way that keeps people as safe as possible.
And so how far off do you think that something like this could be done in humans? Is it something that'd be 10, 20
it's done
years
in
off?
humans now. Absolutely. So we have patients that, like I said,
who don't have already. People who don't have a disease who come in and do it just.
Well, that's under anything that is, any procedure that is done under a relationship, under a clinical relationship and adequate counseling. But this is something that, if under a full understanding of the risks and benefits, should be available for turning back the clock. And the question, how much does it work? Does it work? How much does it work? What are the safety, the risk factors? Those are all important conversations to have in a doctor-patient relationship. One of the things that's important, the American Medical Association has guidelines for innovation in medicine, and those, we follow those, and that is it's an exciting thing to see that, wow, we are able to actually treat these patients that have neurodegenerative disease and to say, we know these people are going to get worse, and we don't have anything else meaningful to offer them.
What would it take for this to be, for more clinics to offer this type of therapy, this type of groundbreaking therapy?
Yeah, well, unfortunately, our healthcare system is based upon, and our belief systems are based upon, insurance should cover it. So, we think, if insurance doesn't cover it or Medicare doesn't cover it, then it must not be good for me. No, that's not it at all. There's many examples in healthcare of well-validated, safe, effective therapies that are not covered by insurance companies. And therefore, you don't see a lot of individuals practicing those particular types of medicine because right now this is an out-of-pocket cost. And it's a repeated test. It is expensive at the present time. We're doing everything possible to bring the cost down, but the cost can range anywhere from $3,500, $5,500, and it's usually in the upper end of that
per session, or is that
per session? Yeah.
Oh wow. Yeah. Mm-hmm.
And in the hospital setting, though, the billing that there's a hospital system I'm well familiar with, bills $14,000 for each one of these sessions.
Wow.
Like I said, so many things are going to have to happen, and we're working to make those happen to decrease the cost by increasing the efficiency, by creating economies of scale, by finding equipment and personnel that are just not so in time and and training intensive. But I believe this is going to be a major component of wellness moving forward. I think that I'm joking about blood washing, but I think it's a pretty good term. We know that eating a clean diet is good for our health. And why is that? Because we're putting less junk inside the system, fewer toxins, fewer inflammatory molecules. So if we have less irritating substances in our system, it stands to reason that we're going to have less degradation. And we don't know what this is. And here's the other thing. I think we'll have some great technologies moving forward, various filters. We can actually, maybe if we can identify what the compounds are in plasma that should be removed, maybe we can use a filter to do that very selectively. But people with dementia don't have time to wait right now. And I think that it's a moral obligation for us to do what we can to move this science forward. And that's why I'm speaking about it. We've got people that come from all over to engage with us to help them in this way. And the more that it's done, the more it will be done. And and I think it's an imperative for people who are looking to maximize their wellness and decrease their aging curve. That's a separate conversation. But it's a reasonable, basic science-backed conversation. And the evidence and the experience we have utilizing these procedures is extensive. So this is not some cowboy medicine. We're not talking about an unknown population of stem cells. We're not talking about anything that is not inside the current drawer of possibilities in standard healthcare.
Yeah, that's a great point.
That's really important for people to recognize. It's amazing to me how many people are resistant to innovation in healthcare. I mean, well, especially doctors. And I think it all goes back down to this. We have something called the standard of care. And the standard of care means, what do the other doctors in your community do? How do they practice? And that's how you should then practice.
Right.
Well, guess what? That becomes a status quo. It's an incredible barrier towards innovation. Now, part of that, there's good reason for it, because doctors and properly prescribed medications are the third or fourth leading cause of death in the United States. I mean,
wow.
That's real. So we need to be cautious about what we do. But I believe we're exercising extreme caution and also moving forward. because we have to change the standard of care as we get new data.
Well, this has been fascinating. For those who listen to this, what can they do? First of all, how can they learn more about you? So remind everyone where they can contact you. But also,
Sure.
what can they do if they have a loved one with dementia, or a loved one with Alzheimer's, or a loved one with MS, so they care about these causes? What can they do?
Yeah. So number one, go to my website, davidhaasemd.com. That's David, Haase, md.com. And we have some videos on there. We have additional learning, and there's ways to contact us and to learn more information. We'll be doing if you go on and sign up for webinars, we're going to be doing a large number of webinars and talking more in detail about this process. So please, again, it's davidhaasemd.com. And as far as what you can do now, hey, there's an interesting thing. You could give blood. One of the things you can do is just give blood, because you're actually going to get rid of a substantial amount of your own old plasma. And it's been known for a long time that the donation of blood has a survival benefit present. We've always kind of thought it's like, oh, that's getting rid of extra iron, or maybe it's thinning the blood so it flows better. But I actually think that this is a inexpensive way for us to get rid of some old plasma. And then you drink water, and now your body's going to have to make its own fresh albumin, but it can do that quite well. So that's just something that that giving blood helps so many people.
Right.
That blood can then be processed in ways that can be a gift of life in truth. So don't say, just because I can't afford, I don't have access to this, I can do nothing. That's not accurate either. People have an immediate opportunity to make a difference in the quality of their blood, which affects the quality of their stem cells. And then there's a whole host of other things we can do to stimulate stem cells for better function, but we can talk about that another time, and I'll put something up on the website so people can learn more about it.
Topic for another episode, certainly. Yeah, that's great. Thank you so much, Dr. Haase.
Hey, thank you, John. Great being with you.
Thank you for listening to the Smart Business Revolution podcast with John Corcoran. Find out more at smartbusinessrevolution.com. And while you're there, sign up for our email list and join the revolution.
Revolution.
And be listening for the next episode of the Smart Business Revolution podcast.